What's that? You're here for tips on how to do well in your hands-on experiences, your hands-on training? Welcome to OT Lifehackers channel, because we are gonna get into that. Welcome everyone, whether you're a nurse, whether you're in your fieldwork for occupational therapy or speech therapy, physical therapy, any of the therapies, or in fields outside of healthcare like social work and such. Welcome to the channel. It is so good to see all of you current and future subscribers. Thank you. Thank you. Please do like and subscribe, guys. Thank you. All right, so you are here for the biggest #1 reasons, well, not reasons, ways to do well in your fieldwork, or basically survive to the point that you can pass. I first want to tell everyone who has been reaching out to me about how to do well in their fieldwork and how to do well in whatever field they're going into with the hands-on training. You guys, I am so excited that you guys are going to be starting what's the most, I shouldn't say most epic, but super epic part of being in your program is integrating your knowledge into the field. It's totally cool, totally different once you get into the field, because you may think you don't know very much, but bam, it just hits you. When you're in there, it all starts flooding in, and you're like, I knew about the Ranchos levels. Oh my gosh, I didn't know I knew about the Glasgow-Coma scale and all of that. Well, I mean, that's for healthcare, but it's incredible, and I want you guys to have the best experience possible. So that's why my gift to you today are these tips. Ready? Drum roll! Boom, 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 boom. One is, do not take things personally. That is number one. Number one, do not take things personally. Sometimes you may have a preceptor or a supervisor, someone who is your mentor that you're working with, who their personality may be a bit strong. And notice I say personality, or the way that they communicate can be a bit strong. Granted, yes, we do learn that you have to adapt your communication to those you're serving and to those that you work with. Best teamwork is to find a common ground, help understand each other, all that. Sometimes, I mean, I wouldn't necessarily try to change your supervisor. So sometimes you have to work with what you got. And even not just supervisors, for me, when I was doing my fieldwork, I had people yelling at me a lot, saying I don't know stuff, even the patients being like, I don't trust you and all of that. And you can't take it personally. I mean, really, if you're gonna be going through the entire day, you have to let go of your ego sometimes and say that remind yourself this is a learning opportunity. And that whatever they're telling me is for the sake of my learning. That these experiences are happening for me to learn. Because if you take things personally, then you're going to be inundated, overwhelmed with your own thoughts, your own judgment, and you don't even know if that judgment is true. You may think, as I'm saying this, that, no, I know, I mean, I had this and this and this evidence. But guys, especially those in healthcare who learn about cognitive behavioral theory, use it on yourself, please. I mean, therapy, use it on yourself. Because, you know, you can't help your clients if you can't practice it on yourself. But really, it's true. If you really have to think about, oh, did I do something wrong? Do they just not like me? Go back to that CBT model, which is the cognitive behavioral theory, and use it on yourself, because you have to think about, what are the facts here? What are the rationales? Is my thinking, and also, you know, use the rational thinking processes. Is my thinking valid? Am I just saying this to make myself feel bad, or is there a valid reason? Even should you find valid reason, that is no reason to hold yourself down, hold yourself back. Rather, number 2 is see everything as an opportunity. Because a quote that I've heard from someone recently, super cool quote, is mistakes are happy accidents. And in occupational therapy, we teach that everything you do, you grow from. Everything you do has a purpose, has something to give back to you. And mistakes are something you do. So you make a mistake because you have an opportunity to do something. No matter what opportunity it is, when you have the ability, the skills, the resources to be able to do something, that's fantastic. And to do something, maybe you make a mistake, but what really is a mistake? Think about it. A mistake can be something that simply someone doesn't agree with. But you think, no, I'm pretty sure I'm doing the right thing, and someone may disagree with you. And so you have to just think of what is best for that scenario. Is it that you just let it go, or you stand your ground? Think about the goals that you're trying to achieve. And there's a lot to do with, that leads me to number 3. There's a lot to do with self-advocacy. That yes, it's very, very, very important to advocate for yourself, but unfortunately I will add a caveat that it's to a certain extent. Explicitly, I mean. Because if you are constantly telling your supervisor that you need more time, you need to do it this way, this works best for you, and your supervisor is not okay with it. They might say it, but maybe they're showing differently. Maybe they don't like it, and you notice that, and you know, something is wrong with this. So you also have to do what is going to help you internally to do well. And that can mean adjusting yourself and improving as you go, trying to figure out other ways. But of course, I still enforce asking for help. You may think your supervisor is a scary person that you don't want to ask for help, and sometimes you can gauge it, sometimes. But there are times when we just assume that we shouldn't ask because we don't want to look a little lolo. I mean, like that we don't know stuff. But again, you take these on as opportunities to grow. Make those mistakes, because mistakes will stay in your memory and help guide you to not make it happen, make those things happen again. And then the last one is set those boundaries. You may think you can do a lot of stuff. Initially, you may be able to in your first few weeks. Sure, you can take on a lot more stuff, probably. But to imagine that you're doing this for months and you're already like giving it your all, and then you're about to poop yourself out after a few months, a few weeks, highly don't suggest that. Highly don't suggest that. So make sure that you are setting boundaries, and that means with the patients too, that if the patients are like they need to be completely hoisted up or carried in the hospital, for example, or if you're doing social work or something else, that maybe there's a big challenging situation that you're facing, maybe it's an ethical thing, for example, and you don't quite know how to handle it, especially with families, don't feel you need to take it on all by yourself. Set those boundaries that you can't put everything into that basket. You have to seek help when you need it. You have to tell the family that you can only do so much. You would love to do much, much more. Say, for example, in the hospital, I would have patients pulling me out on the side to go into the rooms. Every room. They'd be like, hey, I need help with this. Hey, you here, can you come help me? And then so I thought, oh yeah, I should go help. But no, I got scoldings for that because you can't go helping everyone. One, you burn yourself out. Two, your supervisor is wondering where the heck you are because they can't find you in the room you're supposed to be in. And then three, you gotta keep yourself organized. You're gonna inundate yourself with too much information, and some people can work well with that multitasking. Me, I think I need to stay singular. I mean, stay focused on one task at a time. So you have to set those boundaries that, oh, hit that call button. If you need help, ask the nurse. If you need help, ask the respective person. That's not my area right now, so I cannot help you with that. So set your grounds, set your boundaries, set your rules, and you will be able to sustain your own energy for as long as possible, because that is one of the big things that you need to do, is keep your energy flow as strong as possible so that you can last for the entire time while not only just lasting but absorbing information. All right, talk to you guys later. I hope you found that helpful. Please do like and subscribe, and I will see you guys all later.